Hi there. This is KMC coming to you from the Help Desk. We get this question all the time and especially find it during our coaching when a provider doesn't really do any type of a formal report of findings. Now, I come from starting chiropractic in the 1980s when there was a 4-day report of findings, very prescriptive. Everything had to be this word or that word, and it was very, very segmented. What I'm talking about is let's back up to 15,000 feet here and let's talk a little bit about why we would even bother to do what we would call a report of findings. Now, in our world, we have report of findings, ROF, and we have financial report of findings, FROF. They're equally important, regardless of when you do it. I think a lot of things make sense on day two. I think it's always been an idea that, there's some analysis of the patient's condition and the patient's x-rays if you took them, and being able to stop, think, put together a proper plan. And so day two makes a lot of sense. I don't really care when you do it. I just want you to do it. And generally the components of report of findings are largely to educate the patient and to make sure that you have agreement, that you are on the same page, that you understand, that the patient understands what the findings are and why you are making the recommendations for care that you're making. Very often, if we haven't done this more formal version of a report of findings, the patient is left with questions, doesn't necessarily have a time period in which they can ask you their very specific questions. In the old days, as I'll call it, there was a time when, it was important to bring the spouse or bring a significant other with them so that person could also understand what's going on. The scripting from those days was, if it's a woman, I want you to bring your husband with you so he can understand really what's going on with you so he can help you. And then for a woman, for a man, make sure you bring your wife so we can help her understand how to better take care of you while we're treating. Something that would speak to them. I'm good with whatever you want to say around that, but please educate the patient. Please let them know why you came up with the treatment plan that you did, what your expectations are of them. If you do some type of a health talk that they're required to attend, tell them, make their commitment right then, and help them to understand that at that point you're going to hand off to whoever on your team is going to discuss the finances. Now that they have taken the insurance verification, or if they're not insurance, taken also your treatment plan, put those things together and come up with a payment plan that makes sense for the patient to be able to get all the care that you're recommending. We have some great training in the library on what we call, we used to call them the Betty Rubble beads. It's a 12-step kind of process over the course of the first month of care, including what happens on visit 1, what happens on day 1.5 between those visits, what happens on day 2, what we do to do any type of additional education, etc. All the way up to a reconfirmation at the first reevaluation of where we are and how anything will change. Bill Esteb is one of my good friends and certainly a mentor in the area of patient education. And he has never quite understood why we don't also do another report of findings after the reevaluation. Tell them how far they've come. Let them know what there is left to accomplish. Get their recommitment that they're willing to do those additional visits and the things that you recommend and that you require. I love a report of findings. It doesn't have to be super prescriptive. I think there's some bullet points to hit, but one of the things we find when patients do not complete the recommended treatment is that they just didn't understand it. It was never made clear, and the commitment was never asked for that they continue the treatment. If you are a fan or a customer client of the cash practice system, Miles Bodson, I think, is excellent at explaining the report of findings, and they have an excellent financial report of findings tool that we definitely recommend. So if you haven't done it, make a goal this month or this quarter to maybe bring that back. If you need some help, reach in. We're happy to do a consultation around it. Reach out to the cash practice system, Bill Esteb. There's some great resources that you have available to you. But whatever you do, use this opportunity for patient education so they can realize the full benefit of chiropractic care.